causes like flushing, and I'm trying to think what it's called. It's called like a secretotoma, or let's see what these things are called. Now I might have to start looking at, yeah, carcinoid syndrome is what I'm thinking of. Hepatic carcinoid tumor. Let me see if there's anything else. Carcinoid syndrome. No. He has a history of untreated HIV infection. Okay, so laboratory testing shows CD4 count of 50 cells. So that means that this patient has, what they're saying is untreated HIV, and as a result, he's susceptible to certain infections. Okay, so it is infectious now. They're pretty much telling us that. So I was wrong. It's not nutritional. So what infectious diseases affect patients with HIV? They're kind of suggesting that the patient, if they had a normal immune system, probably wouldn't have this disease. So what type of infections do people with HIV, untreated HIV, get that causes a watery diarrhea? So CMV, I would think. So let's see, CMV. Oh, it doesn't, it just says CMV. It's not CMV. Oh, here we go. Stool exam demonstrates numerous oocysts that stain positive with modified acid-fast stain. I don't actually know what that means. Oocysts, are those fungal? Positive acid-fast stain. I'm not gonna lie, this is totally outside of my scope. Acid-fast stain. So this sounds like fungal to me. So what are fungal infections that people can get if they have a bad immune system? So those things I think of like coccidioides. It's not coccidioides. Symptoms persist despite loperamide, so lopiramide's Imodium, and supportive care, but improve after initiation of antiretroviral therapy. Is there some type of HIV associated? No, it doesn't have that. How about AIDS? Which is, nope, doesn't have anything for AIDS. Oocysts. What other types of diarrhea? So there's a bunch of fungal things that people with diminished immune systems can get. There's like blasto, there's like coccidioides, there's these are things that I never think of or see. Aspergillus I think of more respiratory. A lot of these I think of more respiratory, but this is diarrhea. Oocyst makes me think of, I can't think of what that disease is called. People who drink well water. Oh, I can't think of what it's called. Oh my goodness. Well, let's try blastomycosis. No, it's crypto. Crypto's one of those. Yeah. Well, I lost this one. I'm not an infectious disease person, as you can tell, so sorry I blew it. But, oh, it doesn't even give you the little diagnoses thing. Cryptosporidiosis. Oh, here it is, diagnosis summary. So let's learn about crypto. Cryptosporidiosis is an illness caused by obligate intracellular protozoan parasite leading to acute gastrointestinal distress. So that was the hint. That's what they meant by oocysts, was their protozoan parasites. So I was wrong to call this fungal. So sorry, infectious disease people, don't come after me. Crypto leading to acute gastrointestinal distress. It's caused by fecal oral transmission of environmentally resistant oocysts. Basically, when you don't wash your hands after going to the bathroom, often through contaminated water. Common symptoms include profuse watery diarrhea, abdominal cramps, nausea, and weight loss. Workup includes modified acid-fast staining of stool for oocysts, direct fluorescent antibody, or DFA, or stool antigen tests. Treatment involves supportive hydration nitazoxanide. Nitazoxanide is used in immunocompetent individuals. Immunocompetent meaning people with like normal functioning immune systems. Immunocompromised patients require immune reconstitution, meaning you need to fix their immune system. So, oof, day 3 was a little rough for me, but we learned it's cryptosporidiosis. I hope you learned something. See you guys again tomorrow. Bye.